So how long will it take to feel normal again after my rotator cuff surgery? If you've been wondering when the pain will go away, when you can get out of the sling, or when you can finally feel strong again, this video is definitely for you. Let me break down exactly what the recovery process looks like, phase by phase, so you can stop guessing and start making real progress. My name is Dr. Dominic Rangel, and I'm a physical therapist here in San Antonio, Texas. I help active people recover from injury and surgery without setbacks so they can get back to work, training, and life. Today, I'm going to walk you through the realistic timeline after a rotator cuff repair surgery, including a few key products and tools that I personally recommend to make your recovery a little bit smoother. So in phase one, you're going to start off in this protection phase, right? It's going to be like weeks 0 to 6. The first phase is literally about one thing. You have to protect the repair. You'll be in a sling most of the day, and you want a comfortable one that won't destroy your neck and your posture. Usually the surgeon's office or the hospital that you're getting discharged from is going to provide you with one. I would honestly be absolutely shocked if they didn't. The two products that you're going to need for this phase are going to be shoulder pulleys and some type of wand or a cane to assist you with your active assisted range of motion exercises. The shoulder pulleys will start to be used at around week 4. I'll link in both of those in the description so that way you have access to get that so you can anticipate when you're going to start utilizing it. In this phase, you're not going to have any shoulder active movement. You'll begin with just passive range of motion, and your physical therapist is going to be the one who's going to be doing that. You'll be doing things like gentle hand, wrist, elbow, and scapular exercises to keep things mobile. We always want to make sure that you didn't have something called the biceps tenodesis, because that means we can't do any active bicep curls for 6 weeks. Don't worry, you don't have to worry about that. The physical therapist will be the one who figures that out. But we also want to do some things for postural work and breathing drills to avoid compensatory patterns like an overactive upper trapezius and a shoulder hike whenever we're utilizing any type of like arm movement. The key point here is don't skip the icing. It seriously makes a big world of a difference early on. Even if you can utilize like a TENS unit, it's going to help to reduce that like pain and that discomfort that you're having whenever you really can't move your arm. I'll link in the ice pack that I like to use and even a TENS unit that I think is effective to be utilized in this first phase of the rehab process. All in all, the goals are just really decrease the pain, minimize the inflammation, and prevent any early stiffness. You're not gaining motion yet. You're just kind of setting the stage to dive into phase 2, which is the movement phase, right? This is where you're going to get into week 6 to 12. Now we're starting to bring back mobility. We'll progress your exercises to roughly 30% EMG activity. That just means that it's like 30% of the highest activity that your muscle head can operate on. So 100% is pushing as hard as you can, and 30% is, of course, 30% of that. That's why we start with some more active assistive range of motion exercises, progressing toward active range of motion when you're cleared, and still avoiding any type of resistance training at this stage. This phase is seriously, you have to be patient. This is where you really test your patience. Motion should feel gentle. If you're pushing through a ton of pain, you're probably doing too much. You have to modify the angle, you have to modify the volume or the effort that you're utilizing, and that's really where the recovery lives between session to session. You need to progress your isometrics in this phase. You need to start pushing a little bit harder into the wall, and sometimes we're going to use some type of NMES unit to increase the muscle contraction of your rotator cuff, because since it was operated on, its ability to contract is going to be a lot less, which then is going to bring us into phase 3, your strength phase. This is literally everyone's favorite part. Everybody gets super excited whenever we get to this point because you can finally start to load your shoulder. We're going to introduce things like light resistance exercises, maybe some rows. We're going to do some external rotation of your shoulder. We'll do movements like scaption, where you're bringing your arm up into like a V position. We're going to do grip and core drills to rebuild the full body coordination. We're going to do postural strengthening to avoid overload in the wrong places. Some of the things you're going to need for this phase is going to be like a TheraBand resistance set, which I'll also link in the description. I like to use ones that have a handle on them because then you can utilize that for improving your grip strength as well. Once we hit that 16-week mark, I'm going to use a handheld dynamometer to test your strength. So that way we can make sure we're not guessing at what your amount of force that you can produce is, because the numbers are going to drive the decisions, and I'm not just going to go based off of feel. If we're going off of feelings, then we're not really making the best objective decision for you at that time. We're just going based off of whatever we feel like is right. You might still need some activity modifications here. You might need to do like less weight with some of the exercises, go through a smaller range of motion. You might need to do fewer reps. Initially, we're going to avoid overhead work if your symptoms start to flare up. I mean, there's so many different modifications that we can make, and that's why it's super important for you to have a physical therapist that actually understands the process of a post-op rotator cuff repair. Your shoulder's basically going to tell you when it's ready. We just really have to be patient and listen to it. For those that are going to move on beyond phase 2, we have the phase 4 functional training, which is like months 5 to 6. This is where the athletes get to train like for real. They get to start to like throw a baseball, they get to start to hit the ball. For you, like if you're a general population type of person, this is going to be like carrying heavier groceries or picking your kids up over your head. And then, like I was talking about earlier, some type of simulated return to sport or higher level tasks. We had controlled impact work, which we call closed chain activities like push-ups. We're going to increase the amount of load that you're lifting over your head, and we're going to start to include some type of plyometric training, but only whenever your strength is at the level that we need in order to progress to that phase. If you're a tactical athlete or maybe you're an active professional, we also test for fatigue, resistance, and recovery capacity here, because at this point it's no longer just about not hurting, it's about being strong, resilient, and confident. In the last phase, you're going to return to sport or full activity, which is 6 months plus, and it just takes a long time. The rotator cuff is super duper weak, and we just need to slowly build it up. This is your final checkpoint, but also this is where you set the tone for the future. In this phase, you're going to undergo like some specific type of performance testing. We'll recheck your strength symmetry, and most importantly, we'll help you to maintain your gains by giving you a home exercise program that you're going to continue beyond that. There's going to be lots of different products that I'm going to recommend for this phase, and so if you do get to this phase, you're going to want to check out all the things that I am recommending, because you're going to eventually need them. The things that I talk about are going to help you with recovery from all of the exercises that we're going to be putting you through at that phase. So too many people drop the ball here, but just because the pain is gone doesn't mean that the work is over. That's really just the beginning part. You got to keep up a simple maintenance routine, and your shoulder will stay strong for life, but you have to continue to do those exercises. But here's the truth. Your timeline might be a little bit slower than someone else's, or maybe you're going to be a little bit faster. There's different levels and different grades for how we progress somebody through this, because somebody can have one rotator cuff muscle that's torn versus two. It can include like a large tear or a small tear. So there's just a lot of different factors, and that's okay. What matters most is that you're consistent and you're adjusting when it's needed, and you're tracking your progress, and you're not guessing. And if you're not sure where you are in the recovery process, or you feel like you're hitting a plateau, then that's what I'm here for. Like, if you want expert eyes on your shoulder recovery, I offer virtual and in-person consultations to help you. You'll know exactly what to focus on. We'll troubleshoot any of your setbacks and get you back to what really matters. The ways to contact me are going to be in the description, and just comment on here if you have any questions, because I try to answer every single one of them. And if you found this helpful, hit the subscribe button and check. And like I said before, check out the links below for all the recovery tools and all the tools that you'll need along the way, because they help to support the channel and your healing.